Kirsten, who's been working with some of you in the practices in Northamptonshire, but we'll tell you a little bit more about that in a moment. So I'm just going to flick across to share my screen, and hopefully you can see the landing page slide, which says Introduction to Digital Journey Planner. Somebody just confirm they can say that? Perfect.
Yeah, I can see that, Lisa.
So thanks everyone for allowing us to join your session at such short notice. As Craig said, I think somebody's stepped down, but we like being the understudy. So here we are. We've been working with the Digital First Primary Care team for a couple of months and some of your practices. So on behalf of Redmore Health, I'm pleased to share some information with you this afternoon about a product that we have called the Digital Journey Planner, and also talk to you about some of the support that's on offer to you and your practices, because it's being commissioned for you by your primary care team that you may not know about. So my name is Lisa Drake, and my colleague Kirsten's going to be talking to you in a little while. We've got about half an hour's worth of slides, if that's okay. I think everybody's muted for now, so feel free to post any questions that you've got in the chat. We'll open up for questions at the end, but it would be great to know what roles you work in as well, so that we can tailor the session to you and make it more relevant. And if you already have a Digital Journey Planner account, that's great, but there's some new features that you may not be aware of, especially if you created your account some time ago. If you have no idea what the Digital Journey Planner is, hopefully all will become clear as we go through this session. So we know, because both Kirsten and I have worked in practice for a very long time before joining Redmore Health, how busy everyone is in practice at the moment, and we know how hard it is to find time to take a step backwards. But sometimes you've got to take that one step back to be able to take 2 steps forward. So we're going to describe to you a system that we've created to try and help you with that, and try and really embed some of those digital tools that you have available to you. So we also know, because we're all patients in the NHS, that each of us have a different experience, and that there's variation within practices and across practices. So just to continue that journey analogy, most practices are in the middle lane in terms of their digital progress, but with so much for everyone to do at the moment, it's quite difficult for us to see that clear path. We know that there's some super scale practices who've really harnessed the opportunity that digital solutions can provide, and they've maybe created single teams to deliver elements of work such as online consultation hubs or access centres to manage call handling. But unfortunately, there's also some practices still in the slow lane, maybe struggling, not knowing where to start. And there are some who've unfortunately fallen off and they're in the hard shoulder at the moment. So we also know that in your teams, there are some digital stars. And I suppose what we want to do is connect up with them, help them to feel more confident and competent, and then get them to share that learning across the rest of your practices and PCNs. So as I said, we've also got variation within practices as well as across PCNs. We've got some people who are not feeling very confident at the moment. We've got some people who feel that if they offer digital as an option, it's sometimes viewed as a poorer service in comparison to face-to-face. We've got some people who are new to the NHS and perhaps not have realised the benefits that can be experienced from a good online service, and that's in both terms of workload in the practice and workflow management, but also access for patients. But as we said, there's so many competing priorities, it's hard to know where to start, and particularly if you're a very busy practice manager, just the sheer amount of change that you're undergoing at the moment is difficult to put forward a plan. So enter stage, the Digital Journey Planner. So we created this with NHS England, so it's available to all practices nationally, but you've got additional functionality across Northamptonshire. It's a baseline, a learning and an improvement environment. So the baseline element allows your practice teams to answer a set of questions. It's a self-assessment, so nobody can see your answers, and that allows you to see where you are at the moment. The learn element will offer you hints and tips and examples of good practice, and it contains all of the information that you require to be able to do the digital stuff and really good online service delivery. And what we've got is feedback from users. We've got about 1,100 users on the system at the moment. They're saying one of the most helpful features is that they don't have to go trawl the internet for all of the case studies and the policy and the guidance, because we've embedded it all within the Digital Journey Planner for you. And then once you've answered those questions, the system generates what we call a bespoke implementation plan for you. So depending on how you answer those questions, it will give you a plan and you can take elements of that into an action plan, and that's where you can start to share with your PCN. You can share with others if that's who you want to share with. Okay, so this is what the system looks like. As I said, baseline, learn and improve. We've made it a web tool, so you log in with an account. We're all sick of receiving massive spreadsheets from the NHS asking us to tick boxes and never finding out what happens to that information. So we've created it as a web tool. It's one system per practice, but each staff member that logs in with their own account can see what their colleagues have contributed. It's accessed via a web browser, and so there's no need for you to be on NHS networks. So it supports that remote working and working in different practices without you all having to sit on the same network. We've built it in short assessments, so each assessment should take no longer than 10 minutes to complete. And once one member of the team has completed it, the other members of the team sees their answers, and it will be a shorter timescale for them to work through to complete the assessment. The questions within the system are based on the framework of support that Redmore team use when working with practices. We've been working since 2018 with practices, done a lot of work over Microsoft Teams during the pandemic, so we've got lots of national experience now, and this is our framework for working with practices to help you embed digital technology as part of your usual service delivery. And then the improve element allows you the opportunity to work collectively as practices within a PCN. And we're already seeing the opportunities to do this where some ICBs have put in additional support in forms of digital champions, which I think you've got them in Northamptonshire. And then you can then start to say, hang on, why are we doing this in 6 different practices? Why don't we all do this together? More importantly, what it is and what it is not. Okay, so each assessment should take you around half an hour max to complete. So each module, should take you around half an hour. And as all of the team contribute to the one system, it's your story of how you deliver your services. So we want you to be honest, because nobody can see this information. And the example I often use is often in practices we have an IT person or somebody who's got more technical knowledge than everybody else, but the danger there is if we just give it to those people to do the journey planner, all we do is enhance their knowledge. We don't cascade that across the team. So the idea really is to ask new members of the team to complete the journey planner, ask people who don't normally do a particular job to fill in an assessment. So you get to find out what their knowledge level is, but they then get to learn at the same time. So that saves you as practice managers times in terms of teaching. And then that cascading and sharing of knowledge across the team is done by the journey planner for you rather than just sitting beside somebody and somebody else teaching you. So more importantly, I say what it is not. It is absolutely not intended as a performance management system, and we resisted very hard putting some kind of red, amber, green scoring system. So there's no, it's a safe place for you to be honest with about your service provision. And what commissioners can see some very high level details about the types of actions that practices are choosing to work on without being able to see which practice has selected which option. If you are old enough to be remember Blockbusters, this is a familiar kind of graphic for you. We've built the system in what we call building blocks. So patient communications being essential. If we get our patient communications working well, what we realise is a lot of the issues that we have in some of the areas is that patients don't really understand how to do things. So the first module is patient communications. The next module, GP Online Services, builds on that. So we've had online ordering of medication for probably 7-8 years now, and then we brought in online consultations, and of course the online consultation suppliers couldn't wait for us to tell our patients to use online consultation for ordering medicines. But we would say, why would you do that when the NHS app and the transactional services are very easy within the NHS app? Let's stick with the right product for the right purpose. So these building blocks allow you to work through the digital journey planner, ideally from left to right, and build your knowledge as a team. So we've released patient communications, GP Online Services and digital inclusion, because that's really important. And we'll be working on online consultations within the next quarter, and then we'll do clinical system optimization in the new year. And the reason we've done it like this is releasing a module each quarter is so that it's not overwhelming for you, and it gives you time to work on a module at a time to see the improvement starting to take place. a little bit more detail about what's in each module. So as I say, patient communications has got 3 assessments in there: how to use your messaging system really well, how to make sure you've got the best out of your website, and we've put some recent guidance in there that's come out through NHS England, and how to maximise your use of social media. And some practices feel really nervous around using social media, so we can handhold you through that process. If you decide it's not for you, we've got an alternative that we can come up just to try and support you, because most patients are using social media in one format or another. It's a really useful way for you to cascade information. And obviously, I'm not going to go through all of these because you can read those clearly enough. But if you're getting a little bit concerned about the online records access process at the moment, within the detailed care records, we've embedded all of the videos in there that you need, all of the policy guidance, the DPIAs there. We've also put the recent BMA guidance in there, and we're waiting and watching for more update on that programme. We'll update that within the journey planner. So that's the kind of background into where we've got to. I'm now going to go through some slides to show you how the journey planner works. So Kirsten, my lovely colleague, will post into the chat at some point, there we go, the link for the digital journey planner. So if you've not registered yet, there's the link. You can go in and create your account. I'm going to walk you through how to do that now. So the first page is the landing page, which describes what the journey planner is, with a short explanation about how to use it within your practice. Again, you'll see our building blocks here. If you click down on the bottom, you will see login to the digital journey planner at the bottom, and create my account if you've not done that before. So you just click the create my account in the bottom left hand corner. The first thing it's going to ask you for is your practice ODS code. You may know this as your NACS code. If you've been around for a while, it used to be in your NHS email, but if you're not sure where to find it, we've got some links in there as to how to find your ODS code as well. Once you've entered your ODS code and click the continue button, the next page takes you to your login screen. You only have to do this creation of account once. After that, you always just go back to log into account, and the system will remember your email and your password. You can get it to do that, and then you just need to go in and create login the next time. So clicking register there. So once you're logged into the journey planner, you're taken to the welcome screen. If you've got any feedback on the system, you can send us a quick link, but what it will show you is which modules are available and which modules are coming up next. Now, all of these 3 modules are available. As I said, we'll be working on online consultation next. There's a little bit of a narrative telling you about the module and explaining the content in there. And we're going to have a little look now in the patient communications module. So each one of these tiles is an assessment, and you can see here on the top right hand of the box, this one says completed. Before you start the journey planner, it will tell you roughly how long each assessment will take. Some of them 2 or 3 minutes, some of them 7, 8 minutes, some up to 10, all depends on the depth. But most of the assessments are around 20 questions long, and you can save as you go along and come back to it at a different stage. Once one member of the team has gone into the system, the time frame moves from the time to in progress, and once somebody's completed the module, it changes to completion. And you can see here who are all of the contributors in your practice who have contributed to the system. So you can have a look and see who's already been in and had a look. So if you see some of the answers and they don't kind of line up with how you think something's happening, at least you know who to go and have a conversation with and why they gave a particular answer, because you may know something that they don't know, and that's where that knowledge sharing happens. So we're going to have a little look now at the website assessment, because this is a demo system that I'm showing you here, and I'm going to show you what the website assessment looks like. So again, at the start of each assessment, there's a short description explaining what the content is and why it's important. And it's not just why it's important to patients, but also how it benefits you in the practices as well. So we list the benefits right out at the start so that you can see why it's important to do this. And then at the bottom, we would just click the start assessment there. So in the website assessment, you will see across the right hand side here is what we call a navigation panel. So that just gives you the different sections there are within each assessment, and you can see how far when you're working through here. And as you can see, there's a variety of different response types. So some are free text. For example, here we would ask you to pop in your website address. Some of them are simple yes, no, or you're not sure. And some of them are numerical answers where you maybe have to go off and find a little piece of information. I'm highlighting the hints and tips for you here, because if you click on where it says hints and tips, you'll get a little bit more information there if you're not sure about answering the question. But as you work your way through, if you're not sure about any questions, you just move on to the next question, because you'll see that the answers to some of these questions are provided for you in the implementation plan. So as we work through, we've got the save and continue option here. As I say, if you need to go off and do something else because you get interrupted, you just save and continue, or you can skip if you're not sure about a particular section. The system will remember where you were, so you don't need to worry about, oh, did I, I'm not sure where I was, can't remember the questions, did I save all of that? It's fairly intuitive, just the save and continue button at the bottom. And also down here, you can see who last edited the assessment, the date and time, so you can see how current that information is as well. So as I say, if you spot some answers and you think, that isn't really how we work, you know who to go back to and have a conversation. So I'm just going to skip back to the assessment page. So as I say, once the assessment is complete, each one of these assessments, you can click back in at any time to see who's completed. You can see what information they've edited. Excuse me. And then at the bottom of the page, you've got what we call the implementation plan. So you scroll right down to the bottom, and this is where you see your implementation plan. And that's bespoke based on the questions that your team and the answers that they've given. So what we'll show you is where what that looks like now in terms of next steps for you. So you see over here, the assessment titles are the same as they were in the assessment plan. So this is your implementation plan, follows exactly the same format. So we're going to have a little look now at the website implementation plan. So right away, you'll notice that we've followed those technical essential requirements, good practice, etc. But what we've laid it out for is that we show you, first of all, things that you're doing well, because we know that's really important to you. We don't want everybody to feel overwhelmed, and actually it's quite motivating to see where you're doing well. And that's really useful for you to share and celebrate success within your team. But also you may want to share that with your PPG or even CQC if they come knocking on your door. But this is the useful thing that you can share across your PCN. So things that you're doing well, another practice in your PCN may not be, and you can have a conversation about how you've achieved that, and they can learn from you as well. So we will always show you the things that you're doing well first, and then we'll move on to opportunities and areas for improvement. So this is where the resources are presented to you. So although you may be doing things really well, you still may not be aware that there's some good practice out there for you to access. So in here, in the additional resources in this bit, we've got a guide in from an area where it's all around writing clear communications. So again, NHS Digital have got a lovely product called the Content Style Guide, but it's all around aiming your content at a particular reading age. So we know the national reading age is around age 9. So if you write long sentences on your websites or in any of your communications, they're going to be quite difficult for people to understand. So there's some clear guidance here on how to write good, clear communications. And then you spot this little option down here, which is add to an action plan. And the big difference that I want to draw out for you here between the implementation plan and the action plan. So the implementation plan is everything, things you're doing well, things you may want to improve on, but that can be overwhelming. If you think we're going to have something like 10 modules within the journey planner, possibly 5 assessments in each module, you could see very quickly how you could end up with a huge piece of work, and what you need to do is bite-sized chunks. So we've allowed you elements that you can add into an action plan separately. And the idea isn't that you take everything out of the implementation plan and make it an action. We want you to break it down into manageable tasks. So some of these tasks will be very easy, very quick for you to do. You can do them once you've added them to your action plan, work away, and then you move them out of the action plan into archive. And then you take some more tasks from your implementation plan. So your implementation plan is your longer term strategy. Your action plan is what I'm going to work on over the next few weeks or month and get those out of the way. Because some of those tasks in the implementation plan, like if you've got to completely revisit your website, that's one big task, but being able to add certain elements to your website at the moment are short, simple actions. And you can download your action plan either in Excel or as a PDF. And what we're doing is making some improvements to this at the moment. We've been working closely with the team in Northamptonshire to try and improve that. So it's a lot easier for you to see what you want to work on and what you want to leave into the future. So we'll be improving this functionality. But if you couldn't remember what the action was, you can always click back into the implementation plan here and you can see what the content meant and also where the resources are to help you to do that. At the top of the journey planner, you access your action plan just up here by where your login is. You just click into there and you see this page here. And as I say, that's where your content is showing back to the implementation plan. You'll also spot up at the top, next to your action plan, you've got events and webinars as well. So what I want you to do when you've logged into the system is look all around. It's specifically designed in line with NHS Design Service Manual and gov.uk, so it's very simple in its design, but I do encourage you to click everywhere and have a look everywhere because you can't break anything. It's your system. I just want you to click on some of the buttons and see what they allow you to do. So if you're working across a PCN, it may be that you're connected to a number of practices, and if you let us know which other practices you're connected to and your clinical director and your business manager are happy, you will be able to see each practice's assessment. You can see at the top there, we've got Redmore Health. There's a little drop down beside it. If you click there, it will allow you into the other organisations that you're part of within your PCN. So now I'm just going to show you a few tips navigating the site. If you get stuck at any point, if you just click where it says Digital Journey Planner, it will take you back to the home page so you can't get lost in here. If you'd like to log out, you either click on your name or you click on the log out at the bottom there. Again, it just takes you back out and you'll be able to find that home page again. As part of the enhanced support that you've got from our Redmore team, the events and webinars up here at the top will allow you to book directly onto some webinars that we're hosting over the next few months. It also shows you some recordings that underpin the knowledge in the Digital Journey Planner. So we've got one coming up on websites, I think on the 16th of November, if you want to book on and join there. Book on and if you can't manage to come along, don't worry, because we'll send you the resources out afterwards and you'll be able to pick up the recording from this page as well. So this is the forthcoming events page here. You can see that we've run a number of sessions around use of social media. You just click into here to view one of the earlier recordings. If you want to book into a future event, you just click into the one and it will drop straight into your calendar. So Kirsten's been posting some stuff into the chat for you at the moment. So either the link to the Digital Journey Planner or where you can create your account using the ODS code finder. We would encourage you to create your account and start your digital journey. As I say, it's a simple system, really intuitive for you to use. It's there for you to go back to in a couple of months' time. It gives you an idea of some things that you want to work on together. But I think, hopefully, I think your primary care and digital team are hoping that you will use this, and what this will do is feed up into their action plans, how they need to be able to provide support to you. And also, if you're struggling from a digital champion point of view, Kirsten's been supporting a number of your digital champions. I'm not sure if there's any of them on the call today, but if anybody's already used the Journey Planner and would like to give some idea of their feedback, we're more than happy for you to join and just give us a little bit of a chat. So that's a quick whistle-stop tour of the Journey Planner. We've got a little feedback link there for you because feedback's really important for us. If you want to either use that QR code or click onto that forms, just be useful to get some idea of how useful this session has been to you. And then if you want to get in contact with us, you can either contact us support at Redmore Health in general, and one of our team will be able to jump on a call with you, and that support can either be one-to-one, it can be you one to your practice, it may be that we do some workshops with you across your PCN, or we just work with part of your team if there's a particular issue that you feel like you need some help with. And then also, if you're using the Journey Planner, if there's any issues in there that you're not sure about, if you drop us a message to hello@Digital Journey Planner, we'll be able to embed some of those improvements if that's what you see or you're not sure and you need some extra help. And that is the end of the slideshow for now. So we'll just stop sharing for a moment and then come on camera. We've got some time with you now. If you've any questions for us and didn't notice anything, here we go, coming through in the chat.
Also, just to let you know, if you are shy of typing things in the chat and would like to speak properly, you can enable your microphone. They are available for you to make questions as well.
Lovely, thank you. Everybody's always shy. Everybody's always quiet on these sessions. We only need one person to ask a question. I can ask one of you. Have any of you used the digital journey planner? Or is this the first time you're hearing about it? Nope. Thank you, Jane. No, okay. Lovely, Robin, thank you. Okay, so I think I guess what we often experience when we're working with areas is the communication cascade isn't that easy. We know you get loads of emails. We know that some areas have kind of got a weekly bulletin. We've probably been working with your team now for about 3 or 4 months, I would say, maybe longer. We started working initially with the Midlands region. The Midlands region asked us to support them to do some work around websites. Some of you may have got some reports from the Midlands region in terms of the accessibility and usability of your websites. Can I just check out, are you familiar with the new guidance that's come out from NHS England about creating highly usable and accessible websites?
Lisa, what I could probably suggest is we're more than happy as the training hub to create a page around the digital journey planner. So if you have got any information that I can share via that website, please by all means send it through to me, and I'll build a page specifically for that everyone will have access to.
That's super. What platform do you use for sharing?
Currently the website sits on a Joomla platform, but as long as I get information through in any form, well, any format really, be it Word, PDF, link, we can share and disseminate that information.
Super. Do you have access to Future NHS? Do any of your practices have access to Future NHS?
Wrong person to ask.
The reason I'm asking is because NHS Futures have got a page already. So I'm going to post that into the chat for you now as to where all the details sits on there, and some of the recordings. So you'll see some duplication from the work that I've gone through today. But because you've got access to what we call the enhanced license, all of that functionality around the action plan is just available to people who are on the enhanced access, where the national system, which we call foundation, you haven't got that information.
Oh, that would be fantastic. Anything that I can share out to our colleagues, and then I'll do a mailer out to everybody as well, just making them aware of it.
Okay. I will see. We've probably got a MailChimp that we can share with you, and you can share that out to everybody.
Yeah.
But we launched this system in March this year with NHS England, NHS Digital. So there was an article went out in the Primary Care Bulletin. And we, as I say, we've got just short of 800 practices on the system at the moment nationally, and around 1,100 users. So that's the link in the chat for the Futures page. And obviously Kirsten's popped in there, so we'll be busy watching this evening to see how many of you actually create an account. And Kirsten, did you just want to talk a little bit about the website work that we've got going on and how we can maybe support the practices?
Yeah, as Lisa mentioned, the first module is patient communications, because we know how important it is to get the front door right. And Northamptonshire ICB have been particularly eager to improve practice websites. We're doing some work at the moment with practices who are using my surgery website. I don't know if you could give me a thumbs up if you're using my surgery website. Or if you are using it, if you know whether you're on the old legacy platform. They're looking to try to get everybody upgraded, and we are running a workshop on the 16th of November. If anybody is interested in joining that session, I'll pop the details in the chat of the link to register for that.
That's really to say that I've just popped a link in there to the guide from NHS England around creating a highly usable and accessible website. Some of the templates that some of these suppliers provided you, I think my surgery website templates came out probably around 2011-12. They've now got later versions, which they call the digital template. we've been working with a lot of these suppliers directly, as of the NHS England team. They're trying to make it easier for practices by making the suppliers compliant from an accessibility point of view, so you don't need to worry about it quite so much in your practice. But what they're saying in My Surgery website, if you're on one of the old legacy platforms, if they can encourage you to move to one of the new digital platforms, they know that that's a lot more accessible and easier to use for your patients. So in terms of your quality of your website, it makes it easy for everybody, both patients to use it and for yourselves in practice to update. We can also run some kind of show and tell workshops with website suppliers if that's useful. We know that practices worry a little bit about moving websites. We tend to work with suppliers who make that process of moving very easy, so they will lift and shift from your existing site onto a new site for you. You get to see what the new site looks like, but it certainly will be a much easier to navigate site for your patients, and that process should be smooth. So do get in touch with us if we can help you with that. I think we've probably got 12 practices still on the old My Surgery website platform. I think we're still waiting for some replies from some sites who aren't sure whether they want to move or not yet. So I think that's kind of it from our end. If no further questions, we'll leave you to get on with the rest of your meeting. We really do appreciate this opportunity. And do get in touch with us either at support@redmorehealth.co.uk, or Craig, we will send you some information for you to pop up on your training hub page.
Fantastic. Thank you very much. Once again, I just wanted to say how much I appreciate you stepping in at the last minute. It was very, very appreciated. So thank you very much. Can I suggest